Canadians spend a lot of money on their vacations. In fact, according to a recent Leger marketing survey, 1/3 of respondents say they spend anywhere from $2,000 to $3,000 per person on a single trip. Some spend as much as $10,000. So if you don't protect yourself against travel-related diseases, you could be spending that hard-earned vacation in bed or worse, in the hospital, potentially wasting hundreds of dollars a day. Dr. Brian Ah is a travel medicine specialist in Toronto.
The most common ailments that affect travelers include food and waterborne diseases, particularly from contaminated water and poorly prepared foods. These diseases involve travelers' diarrhea, which can affect up to 50% of travelers, but also hepatitis A and typhoid. The countries that pose a risk for these diseases include the Caribbean, Mexico, Central and South America, Asia, and of course Africa, and even Eastern and Southern Europe.
The good news is that there are ways to protect yourself from these illnesses by following a few simple tips.
At least 4 to 6 weeks before traveling, travelers should seek attention from their doctors regarding vaccinations against food and waterborne diseases. There is an oral vaccine, which is a drink, called Dukoral, which prevents travelers' diarrhea. For those travelers who require protection against hepatitis A and typhoid, there is now a unique single-dose combination vaccine called Vivaxum. To receive optimal protection against these diseases, it is best to receive these vaccines at least 2 weeks in advance. However, for those patients who require protection against hepatitis A alone, there is a vaccine such as Vivaxum, which can be given as late as the day you leave.
And when it comes to food and water, don't forget, if you don't boil it, cook it, or peel it, forget it.
To help prevent food and waterborne diseases, avoid eating from street vendors, avoid eating raw seafood, avoid eating unpasteurized dairy products, as well avoid foods that may be exposed to contaminated water like salads. Best to drink commercially prepared bottled water as well as carbonated beverages. Never forget, ice may be contaminated as well as brushing your teeth from the tap. As well, sanitation is always a must. Wash your hands with warm soapy water for 20 seconds and you'll stay out of trouble.
For more information on how to prepare for your next trip, talk to your doctor or visit a travel health clinic. You can visit travelhealth.gc.ca for a listing of all Canadian travel health clinics. Sherry Dematarco reporting.